have a really unique view into the industry. I want to give you a state of our profession. And this is data. This is the real data taken across our universe of doctors. And we have the opportunity now to share with you really what has happened across our nation with this pandemic. So this is new patients. This is taking all the data across our nation and what has happened between February, March, and April with the impact of this pandemic. And we, on average, right, this is new patients and reactivations. Now remember, in our industry, we're considering the reactivations as a patient that hasn't been in our practice for 3 years. So if they haven't been in our practice, BlueIQ counts them as a new patient, and or they've never been in the practice before is considered a new patient. So with that definition, in February, the average practice using BlueIQ was seeing 50 new patients. In March, look at how much that dropped. On average, it dropped to 38. In April, it tumbled all the way down to 25. Talk about an impact. Talk about affecting the mindset of people. And again, a lot of the practices in some states or in some countries around the world were like literally shut down. So we then turned to office visits. In February, on average, 916 a month. That dropped to 771 in March. And look what it did in April, down to 521 office visits. Ouch. So then we go to adjusted production. Now remember, we measure adjusted production versus production, right? This is the value of the services that you're providing on a monthly basis. And to normalize that, we don't want to look at the money that we aren't collecting because of contractual write-offs. We want to look at the real dollar value that we should be collecting. That's why we put a lot more emphasis on adjusted production. In February, on average, the average practice was doing $96,000 a month. In March, that dropped $13,000. In April, it tumbled all the way down to $69,000. Collections, let's look at that. The average practice was collecting $67,000 a month in February. Only dropped just about $3,000 in March, but then really dropped in April as we saw that really begin to affect. Now, May is not a full month yet, right? So we didn't include that data from May yet. But when we look at the percentages of how our profession was impacted by this pandemic, we saw a 50% decrease in new patients in a 90-day period. We saw a 43% decrease in scheduled appointments, a 28% decrease in adjusted production, and a 30% decrease in collections. It's crazy to think that just 90 days ago, we were in the middle of a roaring economy. I mean, really across the globe. And when this came to our door, again, it was almost like overnight, although a lot of people saw it coming. I don't know that many of us realized that we would be going into summer with this type of an impact, and how that affects you, how it affects your mindset, how you're waking up every morning now with this thought of, oh my gosh, 1 out of 5 of my patients are without employment. 1 out of 4, depending on the day we look at the numbers. That can impact your mindset and your excitement to serve your patient base. How am I going to cover the bills? This stimulus check is great, but then what? And that's what I want to share with you today.